Integrity, inclusiveness, community. MLive.com and our 8 print publications make it a priority to empower and strengthen the communities we serve every day through immersive reporting and storytelling. We cover local and national news, sports, arts and entertainment, and more. For almost 200 years, we've brought news and information to those around us, building a trust within the community and establishing a legacy through journalistic integrity. But we're more than that. We are a powerhouse of digital marketing and event planning experts, serving businesses large and small from across the state, nation, and globe. Good afternoon, friends, and welcome to today's MLive.com Guide to Medicare webinar, proudly presented by Priority Health. My name is Eric Hulkran, and I'm your host for today's program. Navigating the complexities of Medicare plans can be a daunting task, but fear not. Our experts joining us today are here with one mission: to simplify and demystify the process. So whether you're a seasoned Medicare beneficiary or somebody just starting to explore your options, our experts are equipped to break down the information into manageable, understandable pieces. So get ready to absorb valuable insights, engage in discussions, and participate in the live Q&A sessions. And by the time we've concluded today's event, you will be well prepared to make informed decisions about your Medicare coverage. Now, we know many of you have burning questions about Medicare, and we want to hear them. So do not hesitate. You can start right now, putting your questions in the chat or the Q&A box here on Zoom, and our team of experts is ready to respond. They're either going to do that directly through the chat replies during the dedicated Q&A on the virtual stage or via email that we'll send out later, because all of your questions and the corresponding answers will be compiled and sent to everybody in attendance via email at the beginning of next week. And this comprehensive document will include not only the Q&A, but other valuable resources provided by our experts. And a quick tip for effective communication: we've all done this before, but just a reminder, make sure you are picking all attendees and panelists. That way everybody gets to see your question, not just me. But if you forget and I see it, I will make sure that they get the question. Now, before we delve into today's enlightening program, we want to express our immense gratitude to our sponsors, without whom this event is not possible. A big thank you to Priority Health, HAP, and Blue Cross Blue Shield. For more information about these fantastic partners, check out the chat or visit our event website. And now, a short message from Priority Health.
What's your priority? Ours is to offer Medicare Advantage plans that give you the care you need.
My priority? To stay active, to do all the things I love.
Priority Health offers easy-to-use, just right plans fit for you.
My priority? To see any doctor I like.
Relationships matter. That's why our network includes 9 out of 10 primary care providers and every major hospital system in Michigan. Call now to speak with a Priority Health local Medicare advisor. Priority Health, coverage that prioritizes you.
Thank you again to our fantastic partners. Now, here's a sneak peek of what we're going to be doing for the next 90 minutes. First, Lauren Glover from Priority Health will provide us a solid overview of Medicare options and the different plan parts, ensuring that we all understand what's covered under each type of plan. Next, our experts will guide you through how to choose the right Medicare plan for your individual needs, and following that, we'll dive into what to consider when selecting a drug plan. During this segment, our experts will walk you through the changes to Part D for 2025 and explain what these updates might mean for your coverage. Guiding us through today is my esteemed colleague and dear friend, John Heiner, MLive Media Group President. John has worked in journalism for 40 plus years, including 38 with MLive and affiliated newspapers, a former newspaper editor and reporter. He now oversees all operations here at the company in Michigan. Now, remember, this webinar is a great opportunity to ask your individual question. You can submit those questions via chat or the Q&A box. Our experts will do their best to respond either directly through the Q&A box or live during the discussion. All right, let's get going. Ladies and gentlemen, it is my privilege to introduce our very first speaker for today's session. Please join me in welcoming Lauren Glover to the stage. Lauren will walk us through the different Medicare options. She will do a side-by-side comparison of traditional versus Advantage plan and explain what the individual parts cover. And Lauren is the Medicare Territory Manager for individual Medicare Advantage and Medicare Supplement plans at Priority Health. Her territory covers central portions of West Michigan, and she's been in the insurance industry for over 11 years, including 4 with Priority Health. Lauren, how are you?
Good evening. How are you? Doing well.
I'm amazing. I will give you the floor, my friend.
All right, so let's talk about a high-level overview of Original Medicare. I think this information will provide the framework to understanding Medicare Advantage. So Original Medicare, what is it? What does it cover? Two great questions. In a nutshell, Medicare is a national health insurance program. It's administered by the Centers for Medicare and Medicare Services, or CMS. It was created in Congress in 1965 to help older Americans, regardless of income or medical history, have access to insurance coverage. Medicare provides health insurance coverage for Americans ages 65 and older, as well as younger individuals deemed permanently disabled by the Social Security Administration for at least 24 months. Original Medicare includes two parts, Parts A and B. So Medicare Part A equals hospital care. It covers most hospital costs after you pay the first portion to satisfy your Part A deductible. At age 65, most people will automatically be enrolled in Medicare Part A, and most people don't pay a premium for Medicare Part A because they paid for it through their payroll deductions. Medicare Part B is medical services. That Part B covers 80% of the cost of doctor visits, everyday medical services after you pay your Part B deductible. You should sign up for Part B as soon as you're eligible, or you may incur a penalty later. You'll also have a Part B premium to pay every month. The standard Part B premium amount is $174.70 or higher depending upon your income. So that amount typically tends to change slightly from year to year. Moving on to Medicare Advantage. Medicare Advantage plans, often referred to as Part C, are an alternative to Original Medicare. These plans bundle Part A, Part B, and usually Part D. They are plans offered by private insurance companies and cover hospital, medical, and in many cases, prescription drug coverage. So there's MA only plans, those don't cover drugs, and Medicare Advantage prescription drug plans, and those do cover prescription drugs. In addition, MA and MAPD plans typically include a lot of extras. So things like vision, dental, hearing, fitness benefits, and more, and often for a $0 monthly premium. So who is eligible for Medicare Advantage? To be eligible for Medicare Advantage, an individual must be eligible for Medicare, right? You've got to have both Parts A and Part B. You've got to live in the plan service area, which is based on your county of residence. And you must pay that Part B premium that we talked about. And you must also be a citizen of the US. Can you switch to the next slide? There you go. And next one. All right, so who is Medicare Advantage a good fit for? What's great about Medicare Advantage, it offers you a lower monthly payment. So if that's important to you, this could be a good fit. If you want more coverage than just Parts A and Part B offers, this is a great option. It also includes those extras we talked about. So prescription drug coverage, vision, dental, hearing, fitness memberships, and more. It's nice because it has predictable co-payments. So if that's important for you, this could be a good fit. If you like having just one plan and one card for all your medical and pharmacy needs, that's what Medicare Advantage offers. And if you want to know the maximum you'll pay out of pocket each year, so you're protected financially. And if you like using a network of providers to save on costs, Medicare Advantage could be a great fit for you. So basically, it's a great fit for most people.
Thank you, Lauren. This is great information, and the information Lauren just showed us is available for you on our resource page and the link in the chat, and we'll also send it to you via email after today's event. So we're going to dive a little bit deeper and discuss how to choose the right plan for your needs and what coverage you should have. For that, we're going to welcome Lauren back to the stage and introduce our other three experts. Margaret Anderson, Senior Vice President and Chief Sales and Marketing Officer at HAP. Margaret leads a dynamic team that is changing the way insurance products are designed and delivered to serve HAP's members and communities. Joining Margaret is Abby Catabaro, Managing Director of Medicare Products at Blue Cross Blue Shield of Michigan, where she oversees Medicare Advantage and Medicare Supplement product development and management. And in her role, she provides strategic direction over product portfolio planning, benefit design, communication, and filing for the health plan. And Bob Callery from the Michigan Medicare Medicaid Assistance Program, just called MAP. Bob serves as the regional coordinator for MAP, supervising a team of over 70 volunteers for Medicare counselors in 9 West Michigan counties, and guiding the entire conversation, my colleague John Heiner. Welcome to all of you.
To all of our panelists for agreeing to join us. And welcome to everyone who's on this webinar. We had over 600 people register, so it's really good to see the interest in this. This is my 3rd year hosting, and I had written a column about the seminar to try to get people to sign up. And I noted in there that something funny happened along the way from last year to this year, and that is I got another year closer to eligibility. And when I host next year, God willing, I will be on Medicare. So 2 years ago, I was curious. Last year, I was really attentive, and this year I'm invested. So thank you all for your time, your generosity of your time, and your expertise on this. And I look forward to a wonderful conversation of past years, any guide. We're going to get some really good questions from people. So I'd like to kick it off with a question for Abby. What are the key factors one should consider when choosing a Medicare plan for 2025? Because I understand there's been some changes going into this year.
There have been some changes. I think the key factors still remain the same, though, I want to say. I'll share with you a handful of key factors to consider. First, you'll want to make sure that you have enrolled in Original Medicare. That's the first step. Once you start thinking about your options, you'll want to consider things like how frequently do you go to the doctor? If you don't go to the doctor frequently, you might want to select a plan with a lower monthly payment. If you go frequently, a plan with a higher monthly payment and lower copays and deductibles would probably be best for you. If you're somewhere in between and go to the doctor regularly, you'll need to decide whether you want a lower monthly payment or lower out-of-pocket costs, such as copays and deductibles, depending on what makes sense for your budget. Do you have specific doctors that you go to? If so, you'll want to check and make sure they're in the network of the plans you're looking at choosing, if you're looking at Medicare Advantage. If you are looking to choose a Medicare supplement plan, you will not have a restriction on a network of providers. Another key factor is, do you take prescription medications? You can add a Part D prescription drug coverage to your original Medicare or Medicare supplement plan. If you choose a Medicare Advantage plan, prescription drug coverage may already be included. Another key consideration is, do you have any chronic conditions such as diabetes, arthritis, asthma, osteoporosis? If you want help managing your chronic conditions, a Medicare Advantage plan may be right for you. If you see doctors often, a Medicare supplement plan could help you avoid paying a large amount every time you see the doctor, but you will have a higher monthly payment. Another thing to consider is, do you want extra benefits such as dental, vision, and hearing coverage? If so, Original Medicare and Medicare supplement plans don't include that extra dental, vision, or hearing coverage, while many Medicare Advantage plans do cover that. Another consideration is, how often do you travel within the US? If you travel outside of the US often, you may want to consider a plan that includes emergency travel coverage. That's also known as worldwide coverage. If you travel often within the US, this will be a big factor for you in choosing a plan because coverage can vary based on your location. And to qualify for Medicare Advantage or a Medicare supplement plan, you are required to live in one state for at least 6 months out of the year. One more factor to consider is if you would like the support of a care management team. A care team can help you coordinate a range of services like home health, rehabilitation, and medical equipment. Medicare Advantage plans do include access to a care management team that will help you navigate the healthcare system and receive care. So those are just a few of them, John.
Well, thank you. And I'm taking notes as you speak. I'm going to be doing that a lot today. I'm not kidding about really paying attention this year. Next question is for Margaret. How has Medicare changed for the 2025 enrollment period? And what should enrollees be aware of about these changes?
Yeah, thanks, John. Thanks for the question. Well, as Lauren discussed in her opening comments, Medicare is really governed by the Centers for Medicaid and Medicare, or CMS is the acronym that is as they're referred to in the industry, and essentially made some pretty significant changes to the modeling in terms of how our product designs get funded, because we really get investments from CMS. We take those investments and put those back into member benefits, which is really an important thing to consider when looking at a plan. And due to those changes across the landscape, if you look at all the plans in Michigan, pretty significant changes to benefit designs, changes to copays, significant changes on the pharmacy piece for some plans, and also on medical deductibles for some plans. So it's really about, as you've heard Lauren and Abby, really looking at what your needs are and deciding, where am I using the most of my healthcare dollar? Is it all in pharmacy? Is it mostly copays? Am I planning to have a big surgery this year? Should I be looking at inpatient cost share as well? So those are going to be some pretty significant drivers. Existing Medicare Advantage beneficiaries all received an advance notification of what those changes were in early October. And so we want to really make sure that folks are familiar with those changes and that you're working to make sure that you're looking at kind of the fine print, particularly on the Part D or the pharmacy benefit.
Thank you, Margaret.
Mhm.
Bob, over to you. Who needs to enroll or, if the case may be, re-enroll?
So it's actually a pretty simple process with Medicare. As long as the plan is still around next year, the beneficiary doesn't have to do anything. That plan is going to automatically roll over into the next year. They don't have to submit any documentation or contact the plan if they want the plan to continue. You don't have to do anything. It'll automatically roll over. If you had received a notice that your plan is going away for next year, there are some plans that they discontinue each year. In that situation, if you're not being consolidated into something else, that would be a good opportunity to actively look and see what's available and evaluate the different plan options and actively enroll at that point, picking something that's going to work best for your needs.
And this is a question that just popped in my head because as I said, I'm heading into this, but if you have a significant life or health change in the course of a year, does that change anything about the next enrollment period? Is there anything you can or should do in that situation?
Medicare does have a long list of what they call special enrollment periods. Moving is a big one. If you lose some type of active employee or retiree coverage, you can change plans. Lifestyle situations, not so much, but financial things, moving, that's a big one. But there are some special enrollment purposes that would allow people to make plan changes throughout the year.
Thank you. I appreciate that. Lauren, how important are Medicare star ratings when choosing a plan? And what do they really tell enrollees about the quality of care and service they can expect?
Yeah, so the Medicare star rating system is a great way to provide an unbiased way of telling beneficiaries how well a plan is performing, how satisfied members are with that plan. So the higher the star rating, it's a scale from 1 to 5. The higher the star rating, the higher quality the plan is. So it kind of helps consumers compare plans that are available to them in their area. So a 5 is the highest score. That indicates that a plan is excellent, and anything with less than 3 stars is considered to be poor quality. And they're judged on things like customer service, member experience, quality of care. How well are they managing the care of their members?
Mm-hmm. Thank you. We're going to go into some coverage and cost questions. I'm going to go back to you, Bob. What are the most common out-of-pocket costs that people overlook when selecting a Medicare plan?
This was a great question. When I saw this, I thought this was an awesome question. So it took me a little bit to think about this, and all the beneficiaries that come and talk to our program, what are the things that shock them? Like, oh my gosh, how did this happen? Or where did these costs come from? Deductibles is one big area where people are shocked. So they always have to check out to make sure their plan, if it has a deductible or not. As was mentioned a little bit ago, going into next year, we got some changes going on with plans. So some plans are starting to offer deductibles. So you want to check that out because that could catch you off guard. Some plans that have co-insurances for certain services. There are lots of plans that have co-pays. So these are set dollar amounts for different services, whereas co-insurances, these are percentages. So you might have, for example, Part B medications that could be a 20% co-insurance. Well, it's not going to be a set dollar amount. It's going to be based on whatever the full cost of that medication is going to be. So keeping an eye out for those co-insurances. And then the other big one that we hear not so much lately, but it always catches people off guard, especially when they're in traditional Medicare and have a Part D plan. If they happen to go into the hospital for observation status, the hospitals aren't able to build a Part D plan. So the beneficiaries typically have to pay the full cost for those medications and then submit claims to their Part D plan for reimbursement for those costs. Usually that's a big one that really catches people by surprise.
Mm-hmm. Well, thanks for alerting our viewers to that. Abby, how should one evaluate whether a plan covers their preferred doctors, hospitals, and medications?
You can do this in a number of ways. You can visit Medicare's official website, which is medicare.gov, or a health plan's website that you're interested in, and search for your doctors, hospitals, drug coverage, right down to the specific drug. You can enter that into your search, and it will show you whether or not they're covered, and you can compare plans that cover them. If you prefer to pick up the phone, you can call 1-800-MEDICARE, or you can also call a health plan directly to discuss your options. If you work with a licensed agent who sells Medicare, you can contact them and they can help you. There are also reputable websites that are non-government resources that can compare plans and sell Medicare plans also. I saw a question come through the Q&A about star ratings. You can see the star ratings directly on medicare.gov when you are looking at comparing plans.
Excellent, thank you. And this next question is one that it's always tripped me up a little bit. Is it possible to receive both Medicare and Medicaid? And I'm going to ask that to Lauren.
Yeah, so I think it's common to get those two conflated. So different criteria, right, for both. So we talked about at the top, what qualifies you for Medicare, being 65 years of age or older, or on Social Security disability for greater than 24 months. It is possible for you to have both Medicare and Medicaid, and people who are qualified for both are what we call dually eligible individuals. So this means they're receiving coverage from both programs simultaneously. So you become eligible for Medicaid, typically based on income. And in a dually eligible arrangement, Medicare will pay the first part of those services, and then Medicaid will pick up anything that's remaining, any costs that are remaining, so that the member is left with no financial liability. You might see plans in the marketplace called DSNP or DSNP plans. Those are for folks that are dually eligible.
Where can people access the income tiers or qualification criteria for that?
That should all be on medicare.gov too. That changes a little bit year to year. So they recently made a change where if you have low income subsidy or you get extra help from the government, that there's just one tier for that instead of multiple tiers. So these things kind of change, so it can be tricky to stay on top of. But you can always call a health plan directly and they can look up your level and see where you're at. We recently went through some Medicaid redeterminations. So if you're already on Medicaid, you maybe had to fill out a packet recently to re-qualify, because we weren't doing that during the COVID pandemic. So lots of changes in that space, but yeah, I would work with either a broker in town that's near you, or call into a health plan for assistance. Yeah.
Thank you, Lauren. Margaret, can I be on a spouse's health insurance and Medicare at the same time?
The short answer is yes. Having said that, there are a number of caveats. So my advice to folks whenever they ask me this question is each situation is unique and different. So again, I agree with Lauren, either call a health plan or call a local agent. It can be a great resource for you. There's fantastic agents that can help navigate this very complex system. But you can be covered. It's just there's a couple different scenarios where there's some caveats that you need to make sure that you're aware of.
Okay, very good. We're going to get a couple questions on customizing plans. And Lauren, I'm going to start with you. For someone with ongoing health conditions, what specific plan features should they prioritize?
Yeah, so what's great about Medicare Advantage is it has all those supplemental benefits that we talked about, which original Medicare or a Medicare supplement plan doesn't have. So for example, one you might see in plans right now is transportation embedded. So if you are someone that's maybe on dialysis and you need help getting to those dialysis appointments, you might look for a plan that has embedded transportation, for example. If you need to see a wide variety of doctors, if a network is a big deal for you, you see a lot of specialists, or you have maybe you go over to the east side for care, but you live on the west side or that kind of thing. You might want to check the network to just make sure all those providers that you see are in the network for the plan that you're looking at. I think Bob mentioned this earlier, but you'll want to understand the plan design, what those co-pays are going to be, what are the services you're most likely to get that you seek the most often, and really take a look at that maximum out of pocket too, because again, that's worst case scenario, that's the amount you would be financially responsible for. So it's good to know that number as the threshold for, you're not going to pay any more than that, even in the worst year. So those are some things to think about.
Good, thank you. And Margaret, are there ways to anticipate future healthcare needs when selecting a plan?
So, I mean, I think that's a conversation for you to have with your doctor. You know, if you have things that you know are chronic conditions like diabetes or high blood pressure, if you have a situation where you know you're planning for a surgery, that's going to be really important. Are there going to be changes to your drugs that you're going to be taking in the upcoming year? Those are all things that you certainly want to consider. And also, as we've talked about a little bit here today, is what we call supplemental benefits. So the things that don't feel like a core medical or pharmacy benefit, like transportation, like potentially food assistance, things along those lines. You know, look at your plans, and these plans are designed for members to use the benefits. I can't stress that enough, because a lot of folks are like, well, gee, I don't want to use too much, or you know, gosh, if I take another transportation ride, is this going to be bad for me? The answer is no. I mean, we want you to utilize the benefits. Embedded in our benefits is our very, very specific, you know, medical management techniques, so that people make sure that, you know, we're removing barriers to access to insulin, for example. So I would just say get really familiar with your plan once you've selected it, and, you know, create your kind of calendar for the year, get your preventive services done, get your annual wellness visit done, and just know that we want you to use these benefits that are in your plan.
Excellent, thank you. And Abby, if someone feels like the plans that they have is not meeting their needs, can they switch? And if so, how would they do that?
There are primarily three circumstances when you can change your coverage. The first is the annual enrollment period. We're going through that now. That's October 15th until December 7th. You can switch from original Medicare to a Medicare Advantage plan, or vice versa during that time. There is also the Medicare Advantage open enrollment period. That is January 1st to March 31st. You can switch from a Medicare Advantage plan to original Medicare at that time. And then, as Bob mentioned, there are those special enrollment periods. Certain life changes allow you to change your plan. So going a little bit into the Medicare annual enrollment period, that October 15th through December 7th, changes that are included there are, as I said, switching from original Medicare to a Medicare Advantage plan. You can join or change a Medicare Advantage plan at that time. You can join or change a Medicare Part D prescription drug plan. And changes that you make during the annual enrollment period take effect on January 1st of the following year. The second instance is the Medicare Advantage open enrollment from January 1st to March 31st. There is a Medicare Advantage and prescription drug plan period that allows anyone with a Medicare Advantage plan to make a one-time change to their coverage. This is extremely helpful if you were unable to modify or change your healthcare plans during the annual enrollment period. And if you're unhappy, if you're dissatisfied with your new Medicare Advantage plan coverage, this is the time to switch. You could even return to original Medicare during that Medicare Advantage open enrollment period if you would like, but keep in mind that this enrollment period is only for people already on Medicare Advantage. And then just to touch on those special enrollment periods, there are several. When certain life events occur, such as moving or losing other insurance coverage, you will be given a special enrollment period to enroll in a new plan. And again, there are over 20 special enrollment periods for Medicare Advantage and prescription drug plans. Each special enrollment period is different. They have different timeframes and rules determining when the new plan will begin.
With so many choices and so many deadlines and periods, and this is the part I think is intimidating. At least I'm talking now as just a common person who's got to enroll. And so we have some really good questions here about navigating the enrollment process and maybe demystifying some of this and make it a little less anxiety inducing. Bob, I want to start with you. What resources are available to help people compare and choose the right Medicare plan?
There are a ton of resources out there. Usually I like to have people start by talking to their family, friends, neighbors, whoever, see what's been working out for them, any concerns, issues that they might have, just to kind of get a lay of the field, see what's going on out there. Any idea of what's been working for people or not, things to consider. Once you kind of get an idea of where to go, different resources that you can go to, the Medicare.gov website is a good resource. Medicare and U-Book has lots of good resources. And then once you start diving into plans, you can go to the different plans directly, whether Advantage plans, Part D plans. You go to their websites, they have lots of good information on there. They have good documents on there, summary of benefits, evidence of coverage booklets are all on there. Most companies have prescription plan review tools, pharmacy network, provider network tools on their websites. Lots of different areas they can go online. They can call the companies directly. If you happen to know an agent, you can go talk to those individuals. And then you can also call 1-800-MEDICARE for questions. And then for anybody who receives the Medicare and U-Book each year, you flip that book over to the back cover. And then you'll find the phone number for our program too, the State Health Insurance Assistance Program. So we're a volunteer program that helps answer questions for people and navigate all the different aspects of Medicare, Medicaid, how that intertwines with Medicare benefits, eligibility factors, all that kind of stuff. So lots of resources out there that people can take advantage of.
And that was a common theme in the last few years too, is start by talking to people who've been through the experience that and trust, family members or friends, and ask about their experience and what's working for them. I think that's always good advice there. One thing I want to tell our listeners and viewers is I recognize we have questions coming in, kind of pouring in here. We have some prepared questions we're going to get to, and then as time allows, we're going to answer as many of your questions as possible. And as Eric said, all questions will get responded to in some fashion, even if we can't get to them in the live webinar today. So thank you for everybody for their questions and interests. Lauren, how can I find an independent Medicare agent and be sure that person is looking out for my best interests?
Yeah, so I have the great privilege of working with the area agents in Michigan. So I meet with these people all the time. They are licensed. They know the ins and outs of Medicare. They have to certify with each of the health plans every year to be able to sell their products. So they are a great source to go to. You can call your health plan and ask to be referred to a Medicare agent, and they will make that connection for you. The other great place, they work a lot off referrals. So if your neighbor works with someone and they can't say enough good things about them, you have to make that call. So that's a compliance thing. They ask for their number and give them a call, especially now, right, during annual election period. Make sure that your needs are covered, because this is the time to review your plan, make a change if you need to. So there's lots of highly credentialed folks out there that would love to help. And the great thing about an agent is you don't pay them anything to review those plan options. So find someone who's licensed with several plans, can review those for you. Make sure that your drugs are covered. Make sure that your doctors are in network and get you in the right plan, and explain some of those co-pays, deductibles, formularies that we talked about that can get confusing.
Thank you very much. Margaret, what are some common pitfalls that people should look to avoid during the enrollment process?
Sure. I think one of the biggest pitfalls is, kind of being attracted to that bright red shiny object. Oh my goodness, this looks like such a great benefit, transportation. Well, in reality, if you don't have transportation gaps and that you can get around, that might not be the right plan for you. And oftentimes, if there's benefits that seem like, wow, that's great, it might be something unique for me to look at. Sometimes that might be an added benefit, but then you might have a higher cost share for copays and deductibles. So just looking at the full spectrum of the benefits and really making sure that, it's going to meet the needs of your plan is really important. And then I can't stress enough, how many people get confused on the network piece and which doctors are in which networks when they're picking products. So just, even if it is that one clarifying phone call before you complete your enrollment to confirm that your doctors are all in the network, because we want to make sure that you've got that continuity of care. That's something that I really recommend folks to do as well.
Okay. Abby, I didn't write this question, but I'm going to be leaning in for your answer. I am turning 65 in 2025. Do I have to sign up for Medicare during the current enrollment period? What happens if I miss that window?
Most people sign up for Part A, which is the hospital insurance, and Part B, that's the medical coverage, when they're first eligible, which is typically at the age of 65. Social Security encourages everyone to sign up promptly to avoid gaps in coverage or late enrollment penalties. However, if you are already covered through your employer health plan, which I think I've seen some questions come through about that, it might make sense to sign up for Medicare later or delay your Part B insurance. If you are at age 65 or older and you receive Social Security benefits, you will be automatically enrolled in Part A. So that's good news. There are three enrollment periods. When you're turning 65, this is the initial enrollment period. There are no penalties if you sign up during this time. After 65, if you've been covered by an employer group health plan, this is one of those special enrollment periods that we talked about. There are no penalties if you sign up or add Part B during this time. If you or your spouse have health insurance through your job, there are 3 options for you to sign up. The first is anytime while you're working and still covered by the group health plan. The second is within 8 months, this is very specific, of the day you or your spouse stop working, even if your employer health plan continues for a period of time. And then the third is within 8 months of the employer health plan ending while you or your spouse continue to work. And your coverage then typically begins the month after you sign up. In some cases, it may start sooner or up to 3 months later, really depending on your circumstances. And then that final enrollment period is the general enrollment period. Now, there may be penalties involved in this. If you have not filed during the other periods, you can still sign up between that January 1 and March 31 timeframe each year. And then your coverage begins the month after you sign up. Again, typically, there is a lifelong monthly late enrollment penalty if you sign up during this time and you don't qualify for one of those special enrollment periods. So that is something to remember if you're approaching 65.
Great, thank you very much. I have a question. We'll just go one by one and answer, and then we'll get into some of our viewer questions. Bob, what's the one piece of advice that you would give anyone who's feeling overwhelmed by all this?
Take your time. Write out a list of what's important. A lot of times, Margaret had her last points were great. You got to look at the big picture of things. So by identifying what's important, writing those out and starting to work your way down the list. And you got to remember, these are health plans first. This is your medical coverage. So that should always be your primary target as you're looking at these plans, and then work your way down from there.
Great. Lauren, your advice?
Yeah, I love that, Bob. The other thing I was thinking about is just keeping a really up-to-date list of those providers. You schedule a new appointment, you see a new provider, keep a running list. If you do work with an agent, bringing that list each year that you meet, or if you meet every few months or so, have that prescription list, up to date. Have a really nice summary. Okay, here are the services I rendered this year. Here's kind of what I'm looking at based on those conversations with my providers. Am I looking at a hip replacement surgery next year? Is that something I need to be thinking about during the annual election period? So just kind of keeping a running list of those hot topics.
Great. Margaret?
Yeah, so first and foremost, kudos to all of you for signing up and joining the seminar, and to MLive for putting it on, because the more you can educate yourself and the more resources that you open yourself up to take a look at and really learn is the huge first step. So I think that would be something, to continue to do on this journey. Secondly, and I'm not just saying this because my colleagues are all here in Michigan, I'm saying this because I think it matters. Think about if you want to work with a local plan that's based in your state, or if you're okay with working with a company or with a plan that's outside of the state of Michigan that might have a headquarters, I'm making this up, in California or Florida. So think about the importance of you working with a plan that might know your market better, and that might have a better understanding of the needs of the network. So for me, healthcare is like politics, it's local. And so to the extent that you want to think about educating yourself on local options, that would be a big piece of advice that I give to folks.
Thanks, Margaret. And Abby, your one piece of advice.
All of the above. I think my other piece of advice that maybe no one's mentioned, those are all great, is keep in mind that all of this information you can find online. Medicare.gov is a great resource. It is the government resource. You can find these questions that you have there. And as Bob said, write down your priorities and start there. And if you need to talk to somebody, Medicare.gov can lead you to that place too. So if you really are feeling desperate, I need some information, Google is your friend, as is Medicare.gov.
Awesome. And we're going to move into the viewer questions now, and we'll get to as many as we can. Panelists, please just jump ball these, whoever feels like you want to answer. Under what circumstances would the Advantage plan be a poor choice?
I could take that. I think if you're somebody that's traveling 10 months out of the year, even if you're in the United States, but if you're someone that's going to be gone quite a bit or chunks of time out of the country, might not be the best option for you. But beyond that, I think we have the 6-month rule where you have to be in a certain residence for 6 months or more. I think that's that's really it for me. It would be the travel constraints.
Okay. Any other thoughts? Feel free, anybody else, or I'll move on to the next question.
Yeah, plans. So I guess I can just speak for Priority Health because I don't know as well the other plans and how they work. But when we talk about travel, that one comes up quite a bit, and the plan can't force a provider to see a member. So that's something to think about. We have a great travel benefit, and we'll do everything we can, but we can't force a provider, like at the Mayo Clinic, for example, to see them. So places like the Mayo Clinic that kind of have a reputation for having people travel to come be seen there, that would be an example where, okay, if I know that's a big deal for me and I want to go to the Mayo Clinic, probably a Medicare supplement would be best in that case.
Okay, very good. I am my sister's care advocate. Do I need to register for permission to register her for a plan this year?
You do need to have appointment of representation. There is an actual form to fill out. And the health plan will look for that on the enrollment form. So if you're going to sign on behalf of the person that you're a caregiver for, I would like to probably see power of attorney paperwork. The plan will probably ask for that if you're signing on their behalf.
Okay. I'm eligible for Medicare next year. I plan on keeping my FEHB medical insurance because it covers my family. I'm wondering what my best options are in this situation.
That's a tricky one. Are you a postal worker? That makes a difference too this year. I think, and that's one I will say, because the federal plan, that's the federal plan that individual's on, is starting to kind of look at subgroups of their population and looking at different alternatives. That's one I would say it's really a case by case and depends on what population you're in. And either go to your plan that you're in now, they can give you guidance, or you can go to the feds and to their actual HR website and enter in your question, and they can give you guidance as well. But your health plan would be a great resource.
Okay. My husband qualifies for Medicare. I'm still working and he's on my health insurance. Everyone says to stick with the employer-sponsored insurance. How do we know this is the best thing to do?
Employer coverage. So comparing that to Medicare benefits, there are three things that I look at when I get that question. First off is premium. What's that beneficiary paying for premium for their plan that they're on? What's the premium for that employer plan? Compare that with Medicare. What's the Part B premium? What's the premium for your Medigap Part D or Advantage plan? Next up, deductible. Some employer plans have gigantic deductibles, multiple thousands of dollars. Whereas a lot of the Advantage plans have $0 health deductibles, or maybe $200 health deductible. And then finally, max out of pocket. If your employer plan has a moderate monthly premium but has a very low maximum out of pocket, that could be beneficial, where you don't have to pay a whole lot for medical services throughout the year. But if it has a $7,000 maximum out of pocket, with a lot of the Advantage plans, you're below that. So it makes more sense to go the Medicare route, as long as the other two aspects kind of line up. That's where I start with that question.
Great. I live in a continuing care facility. I am now independent and healthy. How do I compare coverage for skilled nursing and for assisted living needs? What should I look for to compare?
So there's a specific benefit for skilled nursing that is on the evidence of coverage. So you can see exactly what's covered for those needs. I'm not aware of, and you guys can check me on this, of any plans right now in Michigan that cover an assisted living kind of long stay. So I think that's one where, a lot of people do enact long-term care insurance and things along those lines. But when it comes to actual assisted living fees, typically not covered by Medicare.
Yeah, those are going to be out-of-pocket expenses for the beneficiary.
Yeah, Medicare does not cover long-term care. So assisted living expenses for that facility, that's typically patient pay. There are some Medicaid programs that focus on long-term care, PACE, waiver, nursing home Medicaid. But on the Medicare end, no.
But it does cover hospice.
Yes.
Original Medicare covers hospice.
Yes.
So I hear rumors sometimes that people think, oh, I need to drop my Medicare Advantage plan because I'm entering hospice. That's not true. If you're entering hospice, your original Medicare will pick up the hospice component. You don't need to worry about your Medicare Advantage plan. So if there are, supplemental benefits that you're still using on that Medicare Advantage plan, you don't need to terminate that plan just because you're entering hospice.
Very good. You mentioned a one-time change in Medicare Advantage open enrollment. Is one time mean a lifetime limit or within an open enrollment period?
I think it was the open enrollment period that goes from January through March. So anybody that's on a Medicare Advantage plan, no matter if you just enrolled in December or, the previous year, you can make an election to select a different Medicare Advantage plan during the open enrollment period, which is January 1st till March 31st. And that, if you make the change in 2025, you can do it again in 2026 if you need to.
A great example of a reason why Medicare implemented that election period is if you get started with your plan on January, 1st, and you go to see your specialist is all of a sudden out of network. You didn't know that, you didn't check it. That gives you an opportunity, kind of a get out of jail free card, so to speak, to get you into a plan that does have those providers and the drugs on the formulary that you were expecting.
I think we covered this earlier in the program, but someone has a specific question. If you get diagnosed with something mid-year and incur expenses you didn't expect, can you change plans mid-year?
No.
Okay.
That's not a
No.
eligible reason to make a change.
Mhm.
Okay.
One thing I do want to add with
Sorry.
the enrollment periods, especially the special enrollment and the Advantage Plan enrollment period. Once the new plan goes into effect, even though you might have more months remaining on that special enrollment period, that enrollment period's closed. So you want to make sure that when you're making that decision and submitting that application, you are comfortable with that decision, because once that plan goes into effect, you're in it.
Okay. Next question here. Sorry, got off there. My sister is going to need assisted living in the next 1 to 3 years. Is there anything in a Medicare plan that can help with the cost of such a program?
I think that's a common misconception, right? That Medicare will cover those things, but it's not going to cover like room and board at a assisted living or some such facility.
Okay.
It's just that health insurance. Yeah.
All right. Let's see what else we have here. Did I understand correctly at the start of the program that you still pay the Part B premium even if you choose an Advantage plan?
Yes.
Yeah. And if you don't, you will be terminated from your Medicare Advantage plan. So it's very important that they pay that. I did see another question in the chat though about the deductibles that I talked about at the top. So when you're enrolled in a Medicare Advantage plan, you pivot to those that plan's copays, deductibles, except for the Part B premium. So you don't have to worry about the Part A or Part B deductible. It's now the plan's deductible if they have one, but you do still have to pay that Part B premium.
Okay. Advantage plans have been criticized for problems with prior authorization denials of care, like surgical procedures, off-formulary drugs, etc., leaving unsuspecting clients with tough choices between foregoing treatment versus large out-of-pocket costs. How can an Advantage shopper learn how lenient/flexible a plan is before choosing?
Well, I think you can start with the star ratings piece. So that's going to be a component of the star ratings is how plans perform on appeals and grievances. And so a big part of appeals and grievances is if something is denied coverage. So that is a key component to the star rating. So starting at stars is a good place to start. It's tough to, not many of us that I recall really post and update medical policy and formulary policy. Those changes can happen throughout the year. So it's tough to get in front of. I would say that most plans, especially our local plans here, are going to advocate on behalf of the patient and what's best for the patient and the member. So I would say that, that would be a consideration, really working with your doctor as well. It is a question. We're part of Henry Ford Health System at HAP. And I can tell you that my colleagues at Henry Ford share stories often where they have patients coming in and saying, is there a plan that's easier to work with than not? Like, is there something that I should be looking for? And they're often, happy to offer advice or, just anecdotes, and their office staff has probably got a little bit more information that they can share with patients at that time as well.
Thank you. And last question before I kick it back to Eric to move on in the program. If I'm turning 65 in 2025, what must I enroll in for Part D while I'm still covered by my employer? Parts A, Part B, what do I need to sign up for with D?
So that's going to be dependent upon if that coverage is deemed creditable. Okay. And that's kind of those nuances that Margaret was talking about earlier with, do I leave the group coverage or not? So anytime you're working past 65, you want to make sure that the plan that you're on is deemed creditable. And they look at that as, is it as good or better than Medicare? It also depends if your group is over 20 employees. Things like that make a difference. So that will kind of inform whether they want to stay on that or if it makes sense. Some plans, if you're eligible for Medicare, you have to come off that group plan and enroll in Medicare, in which case you'd have to do all the things. In other cases, you can defer Part A, Part B, and Part D enrollment because the plan meets the needs. So you won't have any late enrollment penalties.
Okay, great. And I want to just take a moment and say thank you to all the panelists. This has been fast, I don't know, 45 minutes or whatever it was. And you covered a lot of ground, but as I said to our viewers, we will make sure that questions that put in the chat get addressed by our experts and staff and get back to you. And with that, I'm going to turn it back over to my co-moderator and friend, Eric Hulkran, and we'll move on with the program. Thank you, Eric.
Thank you. And yes, as always, that was spectacular. As a reminder, John just said it, you'll have access to the event recording, the Q&A of today's session, and other helpful Medicare resources on our resource page. And the link to that page is right now in the chat. And like I said, the email is coming early next week. Next up, let's talk about drug plans. What should you consider when choosing a drug plan, and how do you know if your drugs are covered, and what is new for 2025? To give us answers to these and many more questions, we have Brittany Beeler from Priority Health, and Margaret Anderson is back from HAP joining us. Brittany Beeler is the Medicare business lead at Priority Health, where she provides clinical support for Medicare programs, including Medicare Part D formulary development and product design. Brittany is a clinical pharmacist with 10 years of experience in managed care. Let's welcome back Margaret and Brittany and John, and let's talk all about this.
First of all, welcome, Brittany. It's great to have you join us and our viewers today. And this has always been a good portion of the program and generates lots and lots of questions. The drug plan confounds a lot of people. So we've heard that there are important changes coming to Medicare drug plans in 2025. Could you walk our viewers through what these changes are and how these changes will affect enrollees?
Thank you, John, so much for the question. Thanks for having me. I'm so happy that I get to be here and explain all these because it is a mouthful. There's a lot of changes that are coming in 2025, and a lot of them do impact all you guys. So there's probably 3 big changes that I would say. These include the new maximum out-of-pocket, and I've seen some questions in the chat about that. This new maximum out-of-pocket is kind of the most beneficial for members who have really high out-of-pocket costs. So you're paying a lot of money for your drugs. You're probably on a specialty medication, like something for cancer, rheumatoid arthritis, or things like that. And this is a $2,000 limit, which is very different from the current year and years prior, where we had an $8,000 threshold to be reached before we would stop paying before you would stop paying for your drug costs for the year. So starting next year, it's a $2,000 limit. Once a member reaches this, they reach their catastrophic phase. And this is when you pay no more for your prescription drugs. The second big change is probably the removal of the coverage gap, which kind of goes hand in hand with this maximum out-of-pocket. So the coverage gap is also known as the donut hole. Some of you guys may have never heard of this before. Some of you guys may never need to know about this, really. The donut hole is part of a phase. So whenever you sign up for a Medicare Part D plan, so your prescription drugs, the whole benefit is 4 phases. You have your deductible, if you have one. You have your initial coverage phase, and this is usually where most people are, and they stay for the majority of the year. This is where you're paying your typical copay for your generic or your brand, or maybe a co-insurance. And then once you get out of the initial coverage phase, you hit the donut hole this year and in prior years. And so this is when you pay a higher percentage for your drugs. Once you have gotten out of that donut hole, you've reached that $8,000 limit, you're now in the 4th phase, or the catastrophic phase. And so that's when you pay no more, $0. So coming next year, that 3rd phase, that coverage gap or donut hole, is removed. So you'll just have your deductible, your initial coverage phase. Once you reach that $2,000 max, then you get into the catastrophic phase where you pay no more. And then probably the 3rd biggest change, I would say, is the Medicare prescription payment plan, which is probably the buzzword. Everyone's been hearing about this. This is a new payment option. For anyone who's signing up for Medicare, they will have this option. But what it really does is spreading out your costs. So this is a really big benefit For those people who probably have really high costs at the beginning of the year, maybe a specialty medication where you're paying a large sum at the beginning of the year, this payment plan allows you to take that and spread that cost out over the whole year. So you're not paying a lump sum all at once.
Well, thank you, Brittany. And in response to these changes, do you anticipate that insurers will change pricing and coverage for Medicare Advantage and Part D plans?
Yes. So with these changes come a lot of shifts in payment from the health plans, from the government, from the members. So I do expect these things to change, especially for Part D plans, for your prescription drug plans. The goal of the IRA's changes was to lower prescription drug costs for the members. However, because of these changes and how the liability and the responsibility of these payments shifts, that could also mean that members could have new deductibles that they're seeing on the plans that they're choosing, higher deductibles, higher premiums, or changes in tiers and cost share for 2025 as well.
Very good. Margaret, what are some of the primary factors that older adults should consider when choosing a Medicare Part D drug plan?
So I think it's important to look at, obviously we talked about this before, but what's covered, what drugs are you taking? What do you know you're taking? Making sure that if you're on that borderline as a diabetic, that you have the opportunity to look at the suite of drugs that's being offered for the diabetic population as well. I also think you should look at, are there incentives or things that people could get relative to mail orders? There's somebody that is partnering with that Part D plan that can provide like a 90-day supply via mail order. There may be incentives and different things with reduced copays and such that might help a member that's shopping in that space.
Thank you. Moving into coverage and formularies. Brittany, how can enrollees determine if a drug plan covers their specific prescriptions? And what should they look for in their plan's formulary?
Great question. So I think probably your first resource is to check your current plan's formulary. So if you're already on a Medicare Advantage plan, go ahead and recheck that formulary and see if there's any changes. If you'd like to compare your plan to the coverage of your drugs to another plan and their drug coverage, you could go to Medicare.gov. That's been mentioned quite a few times. It's a wonderful resource to be able to directly compare the drugs that you're taking to the other plans. So you just go to Medicare.gov. They have this plan compare page where you're looking at comparing plans themselves, but also individual drugs that you can type in and compare.
Great.
As far as like what as far as what for a formulary, like as you're looking for in a plan's formulary, you probably want to see if you can get the drug that you're taking at the right price, the price that you can handle. So just really take a look at, is it covered? Things are going to change next year. Make sure that drug that you're taking is still covered. Did it go to a higher tier? What's the cost share or the responsibility you have for that new drug at this tier, and making sure it's something that you're able to handle. And remember, you do have the $2,000 cap now when you're considering that.
Margaret, can you tell our viewers more about new payment plan options for drugs? How will this work? And will all Part D plans offer this option?
So all plans need to offer it. It's a CMS, mandated portion of the Inflation Reduction Act that Brittany just took us through. And Brittany, if you've got a smarter way of explaining this, please feel free to jump in, because I will tell you, when I first read this new program, I thought about, oh gosh, my dad's going to call. What advice am I going to give him? And I wasn't so sure. So basically what it does is it allows you to spread your payments over time. So that $2,000 max, you would actually start paying a fixed amount in January, another amount in February, till you hit that number. So all plans are offering it, but I would say that it is a very confusing program. Again, unless Brittany can come up with a quicker way to make me understand it. But I think it is confusing. The other part of it that I would say is we looked at our Medicare population, and we've got roughly 100,000 members here in Michigan, and maybe close to 15 to 20% of those individuals we would recommend this payment option versus just going with the new out-of-pocket max of $2,000 and just hitting that kind of when you hit it. So Brittany, I defer to you if you've got any other great thoughts on this.
I do have a lot of thoughts on the prescription payment plan, and I would also just kind of echo what you said. This is a new plan. This is something that plans really didn't get a lot of information on until later in the year from Medicare. So like any new plans, there are probably going to be bumps in the road. that's just as a general statement. So just kind of learn the program, ask the questions, make sure it's the right program for you. There are members that are going to be likely to benefit from this program, and there's going to be members that this is just going to be a headache, and you're probably not going to get the benefit that you would want from it. Those likely to benefit from this program are going to be those members, like I mentioned at the beginning, you've got a really high price tag, and it's hard to make that lump sum to the pharmacy. So with this program, you're going to go to the pharmacy, you're going to pay no copay, or you'll get your mail order, you're going to pay no copay at that time. You're going to get this bill in the mail later. And it's not just a 1-for-1, like it's not going to be a bill that's your $60 copay. It's going to take a calculation. It's going to be taking the amount that of your drug costs and spreading it out over the months that are left in the year. So each month that payment could change. So those not likely to benefit from this, if you know your drug costs and you're pretty confident with what you want to do and you like what you're doing, you like the amount you're paying, you're comfortable with it, this is probably not the best option. If you have really low costs, probably not the best option. Sorry, go ahead.
No, sorry, Brittany. From my real life, I'm just a regular old consumer right now with my own private health insurance and stuff. But I show up at the pharmacy and I show them Good RX, and I say this is the Good RX price, and you get a discount and all that. Does any of that matter in the Medicare universe, or is everything kind of just locked in, like the schedules for things? Can you shop prices?
So if it goes through the Good RX card, that's not associated with your plan. So that will be completely separate. Is that kind of like what you're?
Yeah, what I'm getting at is you have are the prices locked in when you're into the Medicare prescription universe, or can you shop prices?
You can shop prices, definitely with coupons. The plan that you're in, you're shopping before you're selecting your plan. You can shop your tier copays, all these different things on Medicare.gov that we're talking about. It'll give you the price. Like, hey, I'm on this generic drug. If I go with this plan, it's going to be a $2 copay. If I go with this plan over here, it's going to be, I don't know, a $5 copay. Or you'll be able to kind of shop that before you enter the plan. But also while you're in it, yes, you can look at various coupons. But that's mainly locked in unless you're in some sort of co-insurance where you're paying a percentage of your drugs. Some people aren't familiar with that term. Some plans will have that for tier 3 drugs. So like a preferred brand drug, you could have a co-insurance where you're paying a percentage of what the drug actually costs. So that can change.
Okay. Thank you. I was just ad-libbing that question. Born from my real life. Let's go into enrollment and plan switching questions. Margaret, what should individuals do if their prescription needs change throughout the year? Can they adjust their drug plan mid-year?
You cannot. So once you elect into the plan, you need to stick with that plan. The only thing that I would say is, you certainly, as Brittany mentioned, there are things like couponing and things that you can look at to save yourself money. But in terms of switching out the actual plan, that's not allowed.
Well, Margaret, how can people compare drug plans effectively during the enrollment period then, and what resources are available to help?
So I think I feel like we're seeing it over and over again. So it's kind of a broken record, but it is the Medicare.gov. I do think this is also where an independent external agent can be of great assistance. If you can have somebody that you can have a one-on-one conversation with, and you don't pay the agent. The agent's commissions are paid by the plan and by Medicare. So really, it's a great service for people to think about. And I agree with what Lauren talked about earlier, getting a referral from somebody, but this is someone that's actually going to do the work for you and then come and present you with your options to say, if you were to go to carrier A, here's what your drugs would look like. Here's what the cost would look like. If you were going to go to carrier B, here's what this would look like. So to really have that work done up front, you certainly can do it yourself. And their tools and technology is out there to do so. But again, I think sometimes having just that extra person to talk to and to ask questions is important, and to have those conversations.
Great. We're going to move into our viewer questions. We have about 15 minutes or so. And these are just whoever, go ahead and grab it if it speaks to you. In terms of people who have chronic conditions other than type 2, that require life-saving prescriptions, how are those covered?
Brittany, you want to take that?
Well, I was just I had more questions for that, but I think it's going to depend on, I think it's
Oh,
going to
yeah.
depend on the plan that you're choosing, the types of medications that you need and the chronic conditions. Most Medicare plans, well, all Medicare Part D plans have requirements to have a formulary. So there has to be certain drugs, certain amounts of drugs. So they're going to have a good selection of drugs depending on the plan that you're looking at.
Okay. This goes back to the donut hole question, and this is a specific example. I'm on 2 tier 3 meds and fall into the coverage gap, and don't get out until December. How might the Part D coverage change? Hopefully that will be a cost savings for me. Will that
And
net
again,
up to be a cost savings?
Yeah.
it definitely could.
Specific?
Again, it's going to be kind of dependent on the plan that you choose, the drugs that you're taking, but you do have that new $2,000 cap. And so actually, you're not even, the way that this $2,000 cap works, it's actually an advantage to our members. So you don't actually have to pay a full $2,000 every person to actually reach it. So once you hit this $2,000 threshold, I'll say, and that is by paying your copays, your coinsurance, and plus some other benefits from other people paying into that, you'll be able to get into that catastrophic phase, and then you'll pay no more for your prescription drugs for the remainder of that year.
Okay. Once someone has been enrolled in Medigap and or a Part D plan, if one wishes to change to different GAP or D plan in next year's enrollment period, for example, is reapproval necessary or would it be automatic?
It's necessary for the medical component. I haven't seen it as much on the prescription drug side, but for the medical component, yes, you would need to get medically underwritten if you're going to change plans from like a plan G to a plan F.
Okay. Who do you contact for financial help with meds?
I think, again, you could look at Medicare.gov. Medicare has a low income subsidy, or what's called an extra help program that was discussed earlier in the program. And that would be a great benefit if you're eligible and you meet the requirements to have low deductibles or no deductibles, really low copays and coinsurance for Part D drugs. But the eligibility requirements would be there.
Okay.
Yeah, and I would also suggest that you talk to your physician, your primary care physician, or your specialist. I can give you some examples. There's programs that provider systems, health systems, and community systems have, or community facilities have in place for this type of thing. So for example, at Henry Ford, we have what we call Game on Cancer, and we raise funds, and it's exactly used for this. So if you're undergoing cancer treatment, for example, and can't meet the copays or the cost of your chemotherapy drugs, you have the ability to apply for funding through Game on Cancer. So there's also funding mechanisms that are outside of the program that are community-based, that I think are really important and very prevalent in Michigan.
That's a great what a service.
Mm-hmm.
If I sign up for an Advantage plan, do I still take Part D? When I was looking at some Advantage plans this afternoon, there did not seem to be a drug coverage component.
So a lot of those are designed, so if you don't have other Part D benefits or Part D coverage, my recommendation would be for you to go into an MAPD plan that would have prescription drugs and your medical benefits. If you are somebody that has worked in the military and have lifelong pharmacy benefits through TRICARE and you don't need a Part D benefit, then that's a great plan for you, because you only have to look at the MA only component. You've already got your drugs covered by the federal government. So that way you wouldn't have to worry about it. But for most people coming new to the program, I fully recommend going into MAPD.
Yeah. I think this question goes all the way back to the beginning when you were spelling out some of the changes that are coming down the pike for Part D. And are the changes you're talking about just with priority or with any Part D plan?
It's any Part D plan. Yeah. This was put down. So Brittany, asking specifically for you, this isn't just a change that Priority Health made. This is a change that was made to the structure of the CMS Part D requirements for all plans.
Okay. There's a last reader question, and I have a final question, but here's the last reader question. Does the $2,000 drug cap apply to off-formulary drugs too?
Your Part D prescription drug costs. So if it's covered by your plan and you get an exception for that drug, then it would accumulate to your $2,000.
Is there a process for getting the exception? I would assume there is.
Yep, all plans, this is a requirement by Medicare, have exception processes in place. So you'd be able to, if you find your drug is not formulary, you can ask for an exception for that. Granted, that's not a guaranteed way to get the drug covered, but it is an option for you.
And I bet you that process is spelled out on Medicare.gov.
Good bet, John.
If I've learned anything in an hour and a half. Okay, last question for me, and you take them one at a time. Brittany, it's starting with you. What are some common mistakes people make when choosing a drug plan? And what is one piece of advice you give anyone to ensure their drug plan meets their needs both now and in the future?
I would say one of the common mistakes that I hear a lot is looking for the big bright sticker tag. So you see something that's bright and shiny and you really like it, like a Part B give back kind of thing, like you're getting money in your pocket. But then you kind of maybe miss some of the other details of the plan. Maybe you're missing that some of the drugs that you need are not covered or they're a higher cost. So really taking into account the whole entire plan versus just paying attention to certain things that sound really good.
Excellent. And how would you answer that, Margaret?
I would say look at formulary, but also know that it's not just a straight formulary, right? There's tiers and there's different cost share on the different tiers for the drugs. So really understanding where your prescription falls on the tier structure so that you can then apply the financial component of the copay. So just, I mean, getting that part of it, it's very nuanced, but once you get familiar with it, you can start to see there's similarities across the different plans, but some might have a drug on a tier 3 versus another company might have it on a tier 6. So just understanding and educating the tiers as well as the copays.
Well, thank you, Margaret, and thank you, Brittany, for your time and your expertise. This is really helpful to me, and I'm sure to our viewers. And with that, I'm going to kick it back to our host, Eric Halkgren. Eric, thank you.
Thank you all. And a big thanks to all of our incredible speakers for sharing their expertise with all of us today. Now we want to ensure you have all of the tools you need to confidently choose your plan for 2025. As a reminder, our resource page filled with in-depth information will be available soon. We'll also be sending you that email with the recording of today's event and the comprehensive Q&A from our experts. Now, before we part ways, your feedback matters a lot to us. We want to know how today's session was for you and if it was invaluable and how we can improve going forward. So please take a moment to share your thoughts in our survey. The link is in the chat. You'll also receive it via email. It means a lot to us. It helps make these events better year in and year out. Once again, a heartfelt thank you to our sponsors who made today's event possible. Priority Health, HAP, Blue Cross Blue Shield of Michigan. Your support is amazing, and a huge thank you. And that's a wrap, friends. We thank you for joining us at today's Guide to Medicare event. We hope to see you again at our next gathering. Until then, take care. We'll see you soon.